discuss that, I am joined now by Onay Kasab, who is the National Lead Officer for the Unite Union. Look, thank you very, very much for joining me. Now, as far as I can gather, reportedly anyway, the offer to NHS staff consists of a one-off payment of 2% of their salary, plus a COVID recovery bonus of 4% for the current financial year, and a 5% pay increase for 2023 to 2024. Is that not a great deal, and should your members not accept it?
Well, it'd be up to our members to decide. The reason why we've not recommended it is that the amount for 2022 is unconsolidated. It is a one-off payment that will not help recruit more people into the NHS. There are vacancies of some 133,000 in England alone. And by its nature, that payment will only go to current staff and it will be a one-off. And then there's the 2023 payment, and that is below the current inflation figure. So that's why we've not been able to recommend it, but we will let our members decide and make the final decision.
Do you sense that the tide is turning? I mean, I've got a copy of the Metro here. It's not typically pro-government. Say yes to end strikes. I've got the Eye again. I think we could all agree it's not particularly pro-Tory. NHS pay deals signals end to wave of public sector strikes. There's a couple of others as well doing the rounds. Nurses deal at last in the Mirror. Everyone wants this done. Should you not just recommend it to your members and, frankly, people can get back to work and the health of our nation can improve?
Well, leaving aside your assessment of the leanings of those papers, the reality is that there have also been considerable concerns expressed about this. I've listened to a number of phone-ins on radio shows where people are saying that the deal was simply not good enough, taking into account where inflation is, how much our members have lost over the years, and what we believe would be a fair pay increase. So I don't believe that the tide is turned. I still feel that the public support NHS workers getting a decent pay increase. But as I said, ultimately, this will be for our members to decide. I think it's worth pointing out that the government said it would not negotiate. And it said that time and time again. And then it was forced to negotiate.
Well, this is
only through strike action.
But this is it. You've got a really nice opportunity here to allow people undergoing things like chemotherapy or that need transplants or that need an ambulance to actually get the care that they want, because you can bracket this as a win, can't you? And I'm looking at this now, the Royal College of Nursing, GMB, Unison, they apparently back all of this offer. So are you worried that if your union comes out, all right, you're not coming out necessarily against it, you're not recommending it, it does make it look a little bit like you don't care for sick people in this country?
No, absolutely not. Our members made it very clear from the first day of this campaign and the strike action that this was more than about pay, that it was about saving the NHS, that the two are inextricably linked. The harsh reality is this, that the crisis in the NHS hasn't been caused by strike action. The crisis in the NHS has been going on for a very, very long time. Waiting lists, the crisis in the ambulance service, the fact that only 25% of shifts have the allocated number of staff on them is not the fault of strikes. And look, here's another point. During the strike action, we agreed emergency cover. We agreed what are called derogations. And what we found is that in many cases, they were actually better than the minimal services provided by the NHS on non-striking days. Well,
I get that. And a lot of people found that quite hard to get their heads around, because people like me were saying, well, doesn't that just mean that there are already people in the NHS who aren't doing their job properly for quite a lot of money, and they're not necessarily the people that you represent, OK? That's that squishy layer of management that a lot of people at the coalface in the NHS, and I can understand why, but seem very reluctant to criticise the lack of organisation or good organisation, the fact that you can have massive strike action. In some cases, I believe the largest NHS strike action that we've seen in decades, if not ever, and for the service to function basically better than it was before, implies to me that the problem lies within the NHS. And can I just suggest as well, from what I can gather, this is a pay offer, OK, and it's been willing to accept it and stop the strikes. I mean, does that not slightly undermine the idea that everyone was out on the picket lines to save the NHS? They were out to save their own bank balances, weren't they? Because there's not a whopping great big addition to NHS funding in all of this, is there?
No, well, look, you can't have it both ways. We've taken a reasonable position to suspend the action so that our members can make a decision. And I think that's the right thing to do. As far as the crisis in the NHS is concerned, our view is clear. That's down to decades of underfunding. It's down to schemes like the Private Finance Initiative. It's down to the fact that over the last 5 years, £4.5 billion has been spent on agency fees. So that's the reason for the crisis. That's the reason that our members have been clear. This is about saving the NHS. That's inextricably linked.
But yeah, they've wrote back because they've got more pay.
They won't come. But if you don't pay people a living wage, then they're not going to be able to work in the NHS. Don't forget, I think everybody now accepts our NHS workers are drastically underpaid. When hospitals are having to provide food banks for their own staff, that's an appalling situation to be in. And I think it's a credit to those representatives and our members who have said, OK, we will suspend the action and we'll properly consider the employers' offer, the government's offer, and we'll take it to a vote.
Can I ask how you felt on Wednesday when it was budget day? OK, now, there wasn't anything in the budget about you guys, OK, and that must have been infuriating for you. We had, according to some reports, more than 100,000 people marching on Westminster, public sector workers, saying, we need more here, we need more here. And the leader of the Labour Party stood up and asked 6 questions about Gary Lineker and didn't mention you once. How did that make you feel?
Well, look, I think you raised an important point at the start of that, which is about the budget. We were told very, very clearly that there would be extra money put up to resolve the NHS pay issue.
So you don't feel a bit let down by Labour?
The question is, where is that money?
You don't feel a little bit let down by Labour?
We are laser focused on winning decent paying conditions for our members.
All right. Look, Onay, thank you. Can I just say I really, really enjoy our chats, and it's great to have you on the show, and thank you for putting yourself forward and coming on. It's always great to talk to you. That's Onay Kasab, there's National Lead Officer at Unite.